to the annual spring seminar hosted by Dr. Joseph Nemeth. We are here at the Burton Manor in Livonia giving a presentation about pain management with Dr. Joseph Nemeth, Dr. Amar Katranji, and Dr. Christian Coachman is here today. We got Yulia handing out bags.
Hello.
Hi.
Would you like a bag?
Yes, please. Thanks.
Hi, how are you? Good, how are you? Thank you very much.
Everyone just filing in. This is where registration is. See you, Kelly.
Monday, okay.
Welcome everyone who's just tuning in. This is the annual spring seminar here at Burton Manor in Livonia. We've got our keynote speaker today who's going to be speaking on pain management in the dental office. Everyone who's here attending is going to get 6 CE dental continuing education credits. This is the entry room where we have all of our vendors. One of our sponsors, United Smiles, the Waterlays, BioLays. He's done a few videos about that. Dynamic Digital Dental Lab. These are all sponsors as part of this event. Everyone is just starting to file in. This is Sarah, the one that makes all this happen. She's the one behind the curtain pulling all the strings here. And before we go into the main room, this is our wonderful booth. So this year, our giveaways are some of these lights. I actually thought these were cool. We have these Dr. Nemeth and Dr. Katranji sticker lights that you can put wherever you want, on your nightstand, on your wall. You flick it on and you have a light. Giving out some information here, referral slips. 2 good-looking gentlemen right there. And let's head into the main room. Team Rehab Physical Therapy. And I'm going to have to lower my voice a little bit because we're right in the middle of this meeting. Right now we have Dr. Katranji presenting.
You can see that shield protecting the bones underneath. So this has really changed the game for me. Not everybody's a candidate, but truly this is the way that I like to do it. We're talking about the anterior cases, but you can also do some posterior. So to go back into the DSD, this is another aspect of what we're doing in the office. Digital smile design isn't like a novel concept. It's not something that Christian Coachman developed on his own, but what he's done is he's put together a protocol and a planning tool for us to use. They're located in Spain, but you can still utilize them just by sending files back and forth. And typically the protocol will just be taking photos, taking some imaging, sending it to their lab. And what happens is they have a multidisciplinary staff. They have orthodontists, surgeons, restorative doctors, lab technicians, everybody on there, and they're all working together to help you plan a case. So when you get on a Zoom meeting, you're there with 5 or 6 different doctors talking about the very specific concerns of that patient. Many times we get patients that come to us, this is a second opinion. This patient was in ortho for 2 years. And she was sent somewhere for implants and she just felt like she wasn't ready. And she's right, she's not ready for implants. She's not ready for bone grafts. And as a periodontist, I don't have the ability to talk to her about the orthodontic either. But I need to present to her a plan, a way for her to get to the point that she wants. And so it's smile driven. We decide what the smile is going to be like. We make sure that she's accepting of that smile. And then from there, we're going to work to get to that end result. So again, if you look at this, there's no way we can place implants. She's not ready for bone grafts. The midline is off. There's so many things off. So after I've sent everything,
I'm going to set the camera down here so it might be a little more stable for you guys.
We discuss all the diagnoses, what's going on. She had a tooth that needed to be extracted. She had many other things going on, and not just ortho and perio. So we can present this to her. When you're done, you actually get a file, a nice presentation to show the patient. So you sit down with the patient and you say, this is where your smile is at now. we're agreeing that we don't like it, this is how we can improve it. And so you do this in a very systematic way with the patient. And this is a very powerful tool when you're sitting in front of the patient, showing them step by step how we're going to improve their smile. So again, you're seeing where the final outcome is, you're seeing where they are, you're test driving the smile and the activity, and you can actually create a mock-up, a three-dimensional mock-up that you can place into her mouth for a temporary moment so that she can see how her smile is going to end up. And if she likes it, we can continue forward. If she doesn't like it, we can always adjust. So then we get the simulation. We see each individual tooth. What do we need to do on each tooth? Some teeth need ortho, some teeth need perio. All of these things are going to be laid out for the patient. So this is a really nice way to plan these cases and then actually talk to your patients about what we're going to do. Especially again, from my standpoint, I can talk perio all day, but talking ortho and other things is very difficult. You get these videos as well, where you can take a look before and after. These are just kind of showpieces, but they really do help. Now, one thing with DSD is you can work with them in any manner that you like. They're a lab, but you don't have to use them as a lab. Personally, they're in Spain, so I'm not going to be utilizing a lab in Spain. So what they do is they work with my local lab, and then together we create the final outcomes. So, like Dr. Nemeth said earlier, he's coming October 25th, which is a Tuesday. We had a hard time getting him for that Thursday, so
Dr. Nemeth is on next.
We said it was going to be the 27th, but it's actually the 25th, and as of today, that's the final date. I highly encourage you to bring your team, bring everybody. I think it'll be worthwhile to see. Thank you very much, and Dr. Nemeth is going to come up and show some of these wonderful cases as well.
Thank you, Amar. And if you haven't worked with Amar, you're missing something. If you have any implant that you do at all, any patient that you bone graft, there just really is no one better. I mean, there just isn't anyone better. He is so thorough, so good, so meticulous. It will be a joy to work with him. And he's a massive credit, of course, but a lot of his focus is on growing bone and implants, and his implants are virtually universally incredibly successful. I have two of his implants in my mouth, which I've had for a number of years. I don't even know what they are. They're absolutely great. And for me to have any problem with an implant would be extremely rare. So I would encourage you, even if you do your own implants, but if you use bone, he's the person that can grow the bone for you better than virtually anybody else that I can have. He's absolutely great. And very lucky to have him as our partner in my office. So let's talk about some of the interesting things that I have to say. During COVID, one of the things that we didn't have a lot to do, so I decided to write a book on periodontal signs and symptoms of periodontal disease. And you can actually get this book on Amazon. You can get this book on Amazon, and I think patients would find it interesting. If you would like a copy, you can call our office. We can probably just send it to you. So this is really interesting that you will never hear about from anyone else. I can virtually.
Sorry, I had to fix the mic really quick.
Because I've been a periodontist for 117 years. I've seen a lot of cases, a lot of interesting cases, unusual cases. It's like I'm where the buck ends. People send cases to me that they have no idea what they are, they don't know why it is, they can't imagine it. And a lot of the cases that I'm seeing with bizarre gum conditions, unusual, bizarre, the tissues are red, the tissues are painful, the tissues bleed easily, the tissues have blisters. In almost all of these cases, when I explore them, these patients have been exposed to strong fumes or steroids 10 to 20 to 30 years prior to the outbreak of the bizarre tissue symptoms that they're having. Typically, a lot of them have had asthma. They've used asthma inhalers. Asthma inhalers have steroids. Steroids compromise the immune system. Well, that's okay. But the important thing is one's using an asthma inhaler to rinse your mouth afterward. And a lot of these people, especially young people, and even adults, they use the asthma inhaler, gives them some relief, but they don't rinse out afterward. If they don't rinse out afterward, this material, the steroids, the immune suppressants are absorbed through the tissues. They get into the body. They don't manifest themselves right away. That's the bizarre thing. They don't manifest themselves for 10, 15, 20 years. It's very bizarre. And I've seen this with asthma inhalers that have been used for many years without rinsing out. I've seen it with people who are exposed to VOCs, which is volatile organic compounds. For instance, we had a patient who was exposed to jet fuel fumes. She worked at Selfridge Air Force Base, and twice a week, 2 or 3 times a week, they fueled the planes, the jet fuel for the planes, right next to the building that she was in, and all of these fumes wafted into the building. So for 4 hours, 3 days a week, for about 3 or 4 years, she was exposed to these fumes. Okay, no problem, no problem, no problem. 8 years later, she starts developing this rash. Let's see if we have a picture of it. Yeah, there it is. That's a rash that she came in with. That's minor compared to some of the other things that I've seen. We've seen tissue with lesions that spontaneously develop. That red tissue, red inflamed tissue, that's one of the kinds of things that I sometimes see with these cases of VOCs or asthma inhalers. One of the major culprits are pain strippers. People who do a lot of pain stripping or exposed to things even like acetone. I had one lady who was a manicurist, and for years she was exposed to acetone, inhaling the fumes. And years later, she started to have very unusual periodontal problems, gum problems. And the problem is, these really can't be cured because they've accumulated in the tissue for many years. You simply can't reverse it. All you can do is try to control it and try to control the pain. So what I'm telling you is, be very careful of VOCs because they can cause a lot of damage without you even knowing about it for years later. Volatile organic compounds, and that in this case includes asthma inhalers, pain strippers, any strong chemicals. I had a patient who worked in a chrome dipping company where they were exposed to the fumes from the chrome dipping. All of these things can be extremely dangerous, and then they don't just affect your mouth. This woman, the one I showed earlier, developed rheumatoid arthritis. Well, no one in her family had rheumatoid arthritis, but a few years before her gingival lesions broke out, she developed rheumatoid arthritis. So it's just something that very few people really know about. But when I question these patients carefully, almost always something bizarre like that turns out in their past, and frequently it's 20 or 30 years prior to what's happening. Now, I want to talk about what we do in the office. A patient comes in. I always take a slide of the bacteria to see what's going on, and I look for parasites like amoeba, spirochetes, trichomonads, and we show that to the patient, and we use a laser to treat this. It's called LANAP, laser-assisted new attachment procedure, and the laser will kill these organisms, and it will kill these parasites, and then we teach the patient how to take care of their mouth so they don't come back again. because we can stop the disease. We can stop the disease cold because it is a parasitic bacterial disease. And if we can stop that infection, we can save the teeth, even in cases that seem hopeless. But the patient has to do their part. If they don't, it will come back. And that's what we tell the patient. So here are some cases that we got bone growth. We don't always get bone growth, but typically we do see bone growth, and usually takes 1 to 2 years before we're seeing the bone growth. And the Nemeth procedure is one of the few, only laser procedures that I think has been approved or got clearance to show bone growth after treatment. Not always, but absolutely sometimes. And here's another case. You can see the before and after. These are about 2 years later. Again, before and after, bone growth with the laser. Periodontitis, again. We're getting many cases but it takes a year or two before we see the bone apposition. And many cases are referred to me because they were told the teeth have to come out. It's hopeless, teeth have to come out. These patients don't want to lose their teeth. They're desperate, maybe for psychological reasons. They want to keep their teeth. And not always, but many times I'll take these cases on. And many times, if we can stop the disease, it is a disease, it's a bacterial disease. You stop the infection, you stop the bone loss. You stop the bone loss, you keep the teeth. In other words, if you can keep the bone you have, you can keep the teeth. Takes a lot of work on the patient's part, more on their part perhaps than even mine. But we can hold on to a lot of teeth that a lot of people think can't be retained. We have several different kinds of lasers. I had the first laser I own the first laser in the United States. We've had 7 or 8 different kinds of lasers. We still have 4 or 5 various lasers that we use for various purposes. This is the BioLase. I know Dr. Katranji uses this for treating peri-implant disease. It's specifically good for peri-implant disease. Right, Amar? I love doing the pinhole surgical technique. I was the first clinician who was given the advanced clinician degree in pinhole, which is what I use for root coverage. And I'm going to show you some cases of root coverage, all using the pinhole technique, which is minimally invasive, minimal discomfort, very, very effective. And you don't have to take tissue out of the palate, which can be uncomfortable or more. So you can see the lower anterior here particularly. This is before and after. Let's see another one. This is, again, the lower anterior, before and after. This is another case, recession throughout the whole mouth. Gums receded on top, on the bottom, gingival recession. These are interesting cases. Look simple. These are some of the most difficult cases to do. Lower anterior cases, especially like this, where there's no vestibule at all, and there's much more bone destruction than you can see here, are very, very difficult because the muscle is pulling that tissue down. Gravity is pulling that tissue down. Every time they move their lip, they're disturbing that tissue. But we've had great success. There is a learning curve, but we've had great success in treating these cases. Let's go back to that last case again, if I can. That's the before and that's the after. Looks easy, not easy, complicated, difficult cases, but I love doing them. I love the challenge. Here's another before and after. This is full mouth. This was an interesting case. Patient came to me. Teeth were totally disfigured from smoking, stain, restorations. We did the pinhole technique, had to modify the bone, and we got what I think was a beautiful and great, much more aesthetic result. We will get some tissue shrinkage, but that tissue is going to look beautiful. This was a lingual one I want to mention, and this was done twice before with a regular connective tissue graft, and it failed twice. This patient came to me, even though there was scar tissue, and it was compromised because of the past surgery and the scar tissue. But we decided to do a modified pinhole procedure, and certainly improved the situation. Was it perfect? No, but it was hugely improved. The patient, of course, was very happy. We worked with implants as well. This was an implant case that needed a lot of work. So we thickened the tissue, we brought it down, and subsequently the implantologist, restorative dentist, was able to complete the case and get a great result. We also do a lot of crown lengthening. This is before, and this is actually a dental student who came to me before and after. Love doing crown lengthening, changes the patient's life. These patients are afraid to smile. You know, they put their hand up like this when they smile, or they put their lip down because they're embarrassed to smile. But when we can change their smile, like we can here, it changes their life, it changes their feeling. We also do something called lip lowering, because sometimes we don't want to lengthen the teeth. We don't want to do that because their teeth are long enough. So how do we handle that? We do a procedure that brings the lip down and also gets the lip thicker. So the lip looks better, and when they smile, doesn't pull back as much and doesn't give them that horsey smile that they would normally have. Now this is a really bizarre and interesting case. This gentleman came to me not because he had a gummy smile. He had a gummy smile on the bottom. So what could we do? He found me and he said, you know, can you do something? So instead of doing a lip lowering procedure, we did a lip raising procedure. I've never done it before. I'm not sure I'll ever do it again because it doesn't happen very often. But every time he smiled, that lower lip came down and he really couldn't stand the way it looked. So we did a lip lowering procedure where we brought the tissue up and brought the lip up. This was the before, and if you look at the after, you can't tell much difference. But if you look, that lip in the left is kind of loose and flaccid and just pulls down very easily. On the right side, you can see that lip is tighter. It's not as blown up, shall we say. And when he smiles, his smile is much better. Again, this is an after shot of this lip raising, not lowering, but lip raising procedure. I'm going to introduce Dr. Carpenter, but I think that Dr. Katranji is going to introduce Dr. Carpenter because he's going to have a lot to say about it, but Dr. Carpenter is very special, and I'm going to let Dr. K introduce him.
Speaker today is Dr. Carson Carpenter, who serves as President of Compliance Training Partners. For over 25 years, Dr. Carpenter has designed practical continuing education programs to help bring dental professionals into compliance with the regulations that affect them. His topic today is pain management in dentistry, strategies for dentists and hygienists. I did want to say one thing. Dr. Carpenter is donating his entire speaking fee to Hope Children's Dental Clinic in Ann Arbor. Hope offers free dental care for children of low-income families and is Dr. Carpenter's favorite charity. So that's a wonderful thing, and thank you very much. Please welcome Dr. Carpenter.
Thank you. Is my mic working here? So I don't do well standing at these things. I need to move around. Thank you to the doctors for inviting me. Thank you everybody for coming out. I see this big audience and I thought maybe they're a good speaker, and I realized it's a required course. Right? We all have to have it. In fact, I've done this course with my wife who did that many times over the years. I remember when Jack Covetti taught the course.
Thank you so much, everyone, for tuning in. This is going to conclude the live stream for today. We do continuing education dental seminars here in Michigan, and if you are in the field of dentistry and you need some CE credits, this is a great way to get it. And every year we do 2 of these. There's one in the spring, hello, and one in the fall. And I appreciate everyone for tuning in. and I hope you found it enjoyable, and stay tuned. We got another video coming out next week that I think you guys will not want to miss. We're going to be testing out a new toothbrush called the Auto Brush. They just sent us the latest model. It's not available to the public just yet, and we kind of have a prototype, so that'll be interesting to see. And again, thank you all so much for tuning in. We'll see you next time.